So yes, my name is Adam Parks, and I am a neuropsychologist, and it's just a fancy word for someone who looks at thinking skills. So technically cognition, but more specifically memory, attention, concentration, problem solving, language skills, all those types of things. So we're the folks who, if you've ever had this kind of testing done before, we'll ask you questions like remember numbers, words, that kind of stuff. And we do so in the context of neurological and psychiatric conditions. Neurological, commonly see folks who have had stroke. Um, I'll talk a little bit about what, well, first of all, let me just go along here. So the title, Memory and Attention Skills, we'll talk a little bit about what memory and attention are from a brain standpoint, but we'll also talk about more so what sort of things we could do to help improve our memory and attention skills, especially in the face of something like a stroke. And so, but before we do that, I want to take everyone a little on a tour of the brain. And so we'll talk more about just generally what the brain is and different parts of the brain, and just to kind of get our orientation to everything. Talk a little bit about what neuropsychology is. I know I kind of briefly introduced it, but more specifically, I'll talk about the different areas of neuropsychology and kind of what our job as a neuropsychologist is to do. And mainly it's that testing or the evaluations of cognition. We'll speak briefly about the attention and memory skills, and then finally I'll provide some tips for sort of overall general cognitive health, but especially these tips are helpful for individuals who've had a sort of brain injury, and I kind of consider a stroke as an acquired brain injury. It's the brain has taken an insult or an injury, and so we'll talk more about that. All right, so our first stop here. Oh, and by the way, please feel free at any point if anyone has any questions. And I know that you'll be on mute, but I think there might be a function to raise your hand, or you can simply just unmute your voice and ask the question at any point. Please feel free. I'd like to make this as friendly of an interactive and discussion-based presentation as possible. So welcome to your brain. It is the source of every single thought, plan, action, desire, fear, emotion. Every single thing you've ever experienced has taken place inside your brain. If we can get a little philosophical here for a second, that's pretty remarkable to think about. So pretty much everything you've ever experienced has occurred inside your head. Obviously, it's also occurred outside of your head and your body to you, but you've all experienced it within your own head and your own mind. And so brains are very important, obviously, for normal human functioning. And unfortunately, sometimes something happens to the brain and doesn't work quite as planned or intentioned. And so that's sort of what neuropsychologists are oftentimes tasked to do, is to determine what happens in the brain when it's not working as planned. Just a little bit of a few quick facts about the brain itself. So it weighs about 2.5 to 3 pounds. It's about 1/3 of a gallon in volume. So you think about a gallon of milk or so, it's about 1/3 of that. The brain is actually made up of, so the composition of the brain itself is 3/4 water, which is actually, I think, the same composition of the whole body. So it mirrors the same composition of the body. And 25% of that of the brain is tissue. 60% of that tissue is fat. And so fat is really important to the brain. And in fact, the connections between the individual brain cells, the neurons, they're all connected through these little spindles that come off of the body of the neuron. Some of them don't have these, but most of them do, and they're called axons. Axons are covered in a sort of sheath, an insulation sheath of it's made of fat, and that fat is really important to produce the signals of those neurons and then propagate that signal down the axon to the next neuron in the process. And this is happening in milliseconds. I mean, it's really, really quick. So when there's a loss of that fat around the axon of that neuron, we have conditions like multiple sclerosis or other neurodegenerative brain diseases. The tissue of the brain absolutely can be affected in stroke when there's too much blood, and hemorrhagic stroke or ischemic stroke, there's not enough blood. Of course, that blood is bringing oxygen and energy and nutrients to that brain tissue. So that can also affect the tissue composition of the brain. So, even though the brain typically only represents about 2% of the total of a person's total body weight, it uses about 15% of that blood supply. And of course, we talked about how the blood supply is really important when supplying the brain with nutrients. In addition to that nutrients, the oxygen is about 20% of the entire body use of oxygen goes directly to the brain. So it is a resource intensive organ of the body, and it's very important. So I've already mentioned that. So then the neurons, there's about 100 billion or so neurons in the brain, give or take a few. And the brain itself is typically divided. Neuroscientists and neurologists and neuropsychologists consider the brain sort of divided in different geographic regions. And so we'll talk about what those are here in a second. Sort of surrounding the outside of most parts of the brain, there's a very thin layer of, it's very, very densely packed neuron cells, and it's called the cortex. And the cortex is really important when it comes to some of those higher level thinking skills and some of the more complex thinking skills. And the cortex can sometimes be affected if a person has a stroke that is sort of on the outside, or a brain bleed around the outside of the brain, or this cortex can sometimes be affected further in if there's a stroke or an injury to a deeper part of the brain. There's cortex that sometimes goes a little bit deeper as well. And then there's this idea between gray matter and white matter. Gray matter is those cell bodies, and so those are very densely packed, and when you look at the brain tissue, it looks kind of gray, so they call it gray matter. And then those axons, the what's called myelin, the fatty tissue around the axons of the neurons, is somewhat white. And so when you actually look at the brain tissue, it turns out to be white matter. So some people may have had to talk to a doctor, a neurologist, a neuropsychologist, or they've had a brain scan done, an MRI or a CT scan, a CAT scan. And the results of those may be varied, but some of it might talk about a stroke that's been found in the white matter of the brain. And so that's a little bit deeper. It tends to be those connections between different parts of the cortex. And so it's important to think about, okay, well, if there is a stroke in the white matter, what areas are being affected? If that's sort of the connection between two different areas of the cortex, then we have to think about both of those areas. But if the stroke is in more of just an area of cortex or an area of gray matter, then we have to think about, okay, is it just that one area that's being affected, or is it the connections to the rest of the brain as well too? So a lot going on when we're trying to determine how a potential injury like a stroke to the brain affects the person's functioning and their cognition. So there's sort of four major lobes, as they call them, plus the cerebellum, which is sort of, I guess, a fifth lobe of the brain, but four major lobes of the brain. So this is the front part of the brain here. So this is a side view. So it's as if I were, let me face the right way. All right, so if I was facing this way, my eyeballs would be right about here under this blue part. And then here's my forehead right here. My ears would be right about here along this green part. And then the back of my head is this red part back here. So the frontal lobe is the biggest lobe, and they're on both sides. So this is just the left hemisphere, because again, I'm facing that way. So this is my left side of my brain. The frontal lobe is really important for a lot of different complex thinking skills, and I'll have them listed on another slide here. So I'll save my discussion of that when I can list them out. Moving backwards from front to back, the parietal lobe is right here, and it's pretty effective when it comes to, again, I'll save my discussion for what parts of a person's cognition and behavior come out with in the parietal lobe. The occipital lobe in the back here, it looks kind of small, but there's actually a bunch of it is sort of on the inside of this one hemisphere. So if you think about it, we're just really looking on the outside section of the brain. There's a whole other inside, and so some of the occipital lobe goes back into the inside. And then the temporal lobe sticks out like this. There's actually, you can kind of see this dark line here shows that this is sort of a separate portion, and it's sort of detached where this can be pulled back just ever so slightly, and then there's other cortex underneath it. Here's the cerebellum, it's at the bottom, and the brainstem's coming off towards the very bottom. But so again, neuropsychologists really are looking at how these different lobes are working, especially in the face of a stroke. and it's something that we definitely take into consideration, especially like I said, when we're looking at injuries to the brain. So the frontal lobe is, again, those complex thinking skills. So something like problem solving, reasoning through something, a person's judgment in various situations, planning and organizing. There's some aspects of attention or concentration, speech production. So there's also some what we call motor aspect of the frontal lobe, and motor being movement based. And so a lot of the movement based aspects of speech come from a frontal lobe. So if a person has a stroke in the frontal lobe, they could have some difficulties producing speech. The language aspect of the speech might still be normal. The grammar might be the same and the words might be similar, but the actual production of the words, either getting them out through the mouth and the tongue, or actually sort of getting to the word that you're trying to say, that's oftentimes more challenging when it comes to a frontal lobe stroke. So speech production is important to the frontal lobe. Motivation is something, so we're kind of talking a little bit more about kind of emotional aspects and motivation and volition of initiating some kind of movement or initiating some kind of thought is important to the frontal lobe. Impulse control, or disinhibition as we call it. And then emotion regulation, so we sometimes see people have difficulty sort of inhibiting their natural tendency to emote in a certain way, and usually we can kind of have a little bit of a filter, but sometimes a person might have a frontal lobe injury or stroke, and they have a little bit less of a filter when it comes to that emotion regulation. So a lot of really important cognitive, behavioral, and emotional aspects of the frontal lobe. The temporal lobe, so sorry, we're going kind of in the opposite direction as I talked about on the previous slide, but the temporal lobe is, again, that sort of side part. It's if you take your hand and you kind of put it over your ear like this, that's pretty much where the frontal lobe is in your brain. So, but it's on both sides, and auditory sensation is really important in there. But kind of two of them, or really three of the most important areas, are learning and memory. So memory is actually housed. Most aspects of short-term memory, or what we call episodic memory, are housed in the hippocampus, and the hippocampus is sort of in this middle part of the temporal lobe. So that part right there, what we'll call the medial temporal part of the temporal lobe. Emotion regulation, again, the connections between the temporal lobe and the frontal lobe are affecting emotions. And then language is really important too. So because we get a lot of, we're receiving a lot of information through the temporal lobes, auditory, coming through our ears, going into the temporal lobes, and going to the rest of our brain, there's some really important aspects of language in the temporal lobe. And so if a person has a stroke and the temporal lobe, they could have something called aphasia. And aphasia is a problem with language, not necessarily the production of the words themselves, but the actual content of the words might be different. The word might be sort of made up, or they might have difficulties understanding other people talking to them. And so the frontal lobe, or excuse me, the temporal lobe is really important when it comes to language. The parietal lobe, it's more affecting parts of the sensation, so how we sense spatial awareness and touch. There's some visual aspects of the parietal lobe because of how it's connected to the last lobe, which we'll talk about here in a second. Coordinating and planning movements, and so these are the connections between the frontal lobe. Spatial relationships, so that is how things are in space, and so depth perception is affected as well. And then language comprehension too. So the parietal lobe is kind of a crossroads between all the other lobes, and it helps sort of coordinate information going to different parts of the brain. And then lastly, the occipital lobe is the very back part of the brain, and that is mostly involving visual processing. So it's kind of interesting that our eyes are in the front part of our head, but our occipital lobe is in the back part of our head or our brain. So the visual information goes in through our eyes, it actually crosses over before it gets deeper into the brain, and then it gets to the back of the occipital lobe. So if a person has an occipital lobe stroke, they might have some visual deficits or visual difficulties. And so this is actually the inside cut of the brain, and so I showed you the outside. This is the sort of the internal side of it. where again, we're looking at the frontal lobe is over here with the eyes. It's kind of probably pretty faint. I'm not sure if people can see that quite clearly, but this slide is just to basically explain that we're not just talking about the cortex. There's also what we call subcortical structures or subcortex. And so these are things like the basal ganglia, which is really important when it comes to planning movements, the thalamus, which is very important when it comes to sensation. I talked about the hippocampus when it comes to memory and so forth. And so people can very commonly have strokes in these subcortical structures. And again, these are much more, sometimes, I wouldn't say much more, but sometimes more challenging to not only diagnose, but also just to determine if someone's having difficulty with their day-to-day functioning or their cognition, if that's because of that stroke in one of these subcortical structures. It's a little bit more challenging for the neuropsychologist to identify those difficulties. I already kind of talked about the gray matter and white matter, and so this is just describing how the gray matter, the cortex, is along the outside here, and then the white matter are these connections. It's sort of blurred here, but there are different connections between the different parts of the outside cortex, and then also there are some gray matter structures deeper in the brain, as I mentioned. Again, the connections in the brain. So this is I think an artist rendition, but there are different types of brain scan technology that we can have to actually measure these connections. And so it used to be the case where just the cortical parts of the brain were most focused upon, but it's probably within the last 10 or 15 years that these connections, the white matter tracks as we call them, are much more focused in research, but also within clinics. So we can actually do a brain scan that is very similar to this, where we look at the connections between the different parts of the brain. This is very, very busy, and probably a doctor wouldn't be looking at this image necessarily, but they might look at one or two of these different color tracks along probably the language circuit, which is one of the language circuits, which is in the temporal lobe. But this is just to provide a pretty picture of the brain for everyone to look at, basically. So when we talk about stroke, obviously we're referring to an area of the brain that's been affected by either too much or not enough blood. And so just real briefly, I'll include some of these. We don't have to go over all this, but there's a lot of different ways that the brain can get blood through all these different arteries. And but it's when there's either blockage in one of these arteries, or one of these arteries or a smaller blood vessel bursts open, that you could have a stroke. And then that's when obviously the issues of that stroke arise. And so again, where that is in the brain can affect a person's functioning and their cognition and their behavior. Okay, so that's kind of it for the tour of the brain, and now we'll talk a little bit about neuropsychology. So neuropsychological symptoms in different neurological and neurosurgical conditions, they vary widely in when they come on, how bad they are, what kind of treatment might be needed, and then also where they're located in the brain. And so that's, again, the job of the neuropsychologist to determine where those symptoms are sort of coming from when we talk about locations in the brain. Different neuropsychological symptoms can include speech and language problems, memory problems, concentration and attention deficits, visual spatial difficulties. So again, issues with like depth perception or being able to see a full visual, if you think about like your full visual field, sometimes a stroke that affects the visual field can sort of cause a blocking of that part of the visual field. Reduced judgment and reasoning skills, and then also emotional changes. So those are just some examples of different neuropsychological deficits or symptoms that we might see or might talk to patients about. I included this real brief history lesson on neuropsychology because really a neuropsychologist was really, really helpful and useful way back before we had all this new fancy neuroimaging technology. I think CT scan maybe came out in the 50s or 60s, and MRI came shortly after that. So really before that, before we had the ability to sort of quote unquote look inside a person's brain, the neuropsychologist was performing tasks and tests with the patient to be able to sort of identify where the location of the stroke was. But thankfully, we've become a lot more accurate in knowing more and more about where the location of the stroke is, and because we're able to do these newfangled neuroimaging studies. So again, the neuropsychologist helped sort of determine where the location of the lesion was, like a stroke, was in the brain. Neuropsychologists didn't go away, they just adapted, and now they focus a lot more on understanding and characterizing the symptoms that a person has, that we've already discussed, and then also, what can we do about it? How can we sort of improve a person's cognitive and day-to-day functioning despite the injury or the insult such as a stroke? And so again, the neuropsychologist is sometimes tasked to provide recommendations or even a course of treatment plan for a patient to help alleviate as much as possible the symptoms that are being experienced based upon the testing that might be done. We don't have to go into too much of this, but just to provide if anybody has ever seen a neuropsychologist, or if you heard that term before and you're curious, we are doctoral level clinicians. We have this kind of phrase, brain behavior relationships, and that's sort of a pet phrase that I think every neuropsychologist has used or heard of one time. But again, evaluation is really important. So the testing is a big part of our day-to-day clinical jobs. Education is also a really important thing to do as well. We consider, it's one thing to sort of do all these tests, but it's like, well, what does that mean? If we get some scores on some tests, what do you do with that information? And so education of both patients, of family members, of caregivers can be really helpful when it comes to the results and sort of the follow through when it comes to our testing and evaluation. And then some neuropsychologists, because we're actually originally trained as either clinical or counseling psychologists, we do tend to want to involve some kind of treatment, and that may or may not be involving kind of behavioral or cognitive based therapies. So again, we're mostly concerned with the functional impact of a stroke, meaning how does this actually affect a person's day-to-day life? Again, it's one thing to get some scores that might help track a person's progress through rehabilitation. That might help track a person's changes over time, but it's sort of what do you actually do with those scores that's most helpful, and how that can most affect a person's day-to-day functioning. The functional impact is really important. So, excuse me, just a brief overview of the type of testing. I've already mentioned a few of these types of tests that we'll use. This is just if you Google image search neuropsychological testing, they just have people sitting across a table from somebody. There was a few months there that we really didn't do a whole lot of this face-to-face testing, and now, of course, when we do it, we're wearing PPE and everything. But we actually our clinic was able to respond fairly quickly based upon the health system. I think had a very, very smooth and quick rollout of our ability to perform telehealth visits with our patients. I think I heard something along the lines of they took a 2-year process, what had been planned a 2-year process to roll out telehealth, and they crammed it all into 2 weeks or so. So very quickly we were able to adapt our telehealth, our face-to-face testing to the telehealth environment. So I would be doing testing just like this with a person face-to-face over the secure connection. And we're not able to do everything. So like, for example, this patient probably is not a real patient, because that wouldn't be the privacy of taking a photo there. But an example of a patient is performing a task with these little blocks. Unfortunately, we can't do this with somebody over the telehealth. So we're not able to do everything that we can over telehealth, but it's definitely something that we've tried to make as accessible as possible, especially during these times of social distancing. So the different abilities that are often tested in neuropsychological testing, again, processing speed, attention concentration, memory and learning ability, language skills, visuospatial executive functions, which is sort of the technical term for the reasoning and planning and organizing. It's those most complex thinking skills. We call them executive functions. And then we do a little bit of emotional behavioral testing as well too, and that's traditionally in the form of performing a questionnaire, a self-report questionnaire, where a person's filling out a form, just rating on how they're feeling and on various scales and things like that. So our testing typically takes anywhere between 1.5 to 2 hours to complete. I know it sounds really daunting, but once you're actually in it, you can get through it pretty quickly. The testing itself, again, we try to make as painless as possible, but some of it could be a little frustrating because when you're sort of put on the spot and asked to, think of some numbers or think of a word or draw a picture, it's not something that we're really asked to do every single day, but we have to do that in a very objective and routine way, that we're giving the same test over and over again to every person that we see gets the same test in the same way every single time, because we need to be able to compare people to um, a comparison group of healthy individuals, and we're able to look at and control for a person's age, but also because we don't want to necessarily compare somebody to if I have a patient who's 60 years old, I don't say, I want to compare your memory to someone who's 18 years old. That wouldn't be fair. That wouldn't even be fair to me. But we were able to control for age, which is really important. Also education as well too. So there's some sort of behind the scenes statistical testing that we do with these scores. So it's not just like a one and done when it comes to the test scores. Okay, so that's enough of the neuropsychological testing. Real briefly, I want to go over, make sure I have enough time, of course, for any questions or anything at the end, but real briefly, I'll talk about attention. So another word for this might be concentration or focus. It really is just our ability to sort of hold our attention to a specific task, something that we're doing. It could be something as passive as, say, watching television. It could be reading a book. It could be filling out paperwork or forms that unfortunately we often have to do, especially if you're involved in any kind of medical care. And so, with attention, you really want to be able to focus and pay attention. And if I haven't lost anybody yet already, you've been, honing those attention skills by paying attention to this talk so far. So, but there's different ways that we're able to test those attention skills in our clinic. There's, sometimes we make the distinction between auditory, and so that's sort of verbal or out loud, and visual attention. And so that's something we can kind of test for. There's this idea of shifting attention. And so I often hear from folks tell me that they're noticing they're having a harder time multitasking. And so I kind of will talk a little bit more about that. And then I'll sort of tell them, for example, this is sort of what I might look like if I'm at work and trying to multitask. So I've got, I'm working on the computer, I'm talking on 2 different phones here, and I'm going all sort of doing multiple things at one time. Well, that's actually kind of a myth, even for a person who has a really, really good multitasking ability. What they're actually doing is just sort of switching your attention back and forth, shifting attention between different tasks very quickly. And so you're really only able to hold your attention to one thing at a time. But if you feel like you're pretty good at multitasking, then you can kind of go back and forth without losing track of what you're doing on the previous task. So when I hear somebody tell me that they're having a harder time with multitasking, I think about this picture, but I also might think about this picture. And so the ability to do more than one task at a time is really just a difficulty in shifting. It's the actual shifting part of attention skills that becomes problematic, and less so of just being able to juggle 15 things at one time. Sustaining attention. So if you think about any kind of task or activity that you need to hold attention to over a long period of time, that's sort of sustaining attention. Again, something we can test for. And then we talk about, well, what happens when attention is broken, when you get distracted from something. And so there's sort of 2 different main types of a distraction that I would like to talk to patients about. And so one might be an external distraction, and this is very obvious to people whenever it happens. So, if you have one of these in your pocket, it's going to distract you quite frequently, especially if it's beeping at you and ringing all the time, and that can be very distracting, especially if you're trying to perform a task or do something important, an external distraction. But sometimes we don't always think about these internal distractions that we might have, and these might be our very own thoughts and emotions. And so if you have a thought kind of pop in your head and it distracts you from what you're doing, that could be that your attention was broken from what you were doing. So I don't know, next time you feel like you're having a hard time with focus and concentration, probably take a second to think a little bit more about, well, are there any distractions going on that is preventing me from being able to hold my attention to what's in front of me. Okay, so memory is a little bit more of a complex process. But generally speaking, we think about it as just our ability to take in information, retain it or hold on to it, and then use that information in our day-to-day lives. That's sort of the most basic breakdown or understanding of our memory ability. There's oftentimes this distinction between short-term and long-term. At least when I talk to folks, I sometimes will use short-term within a matter of either a few minutes all the way up to about a day or two, and long-term can be several years ago. When we're much younger, memories from those times we tend to think about as more long-term. And then there's two different types of long-term memory. So long-term can be within a matter of, I'd say, a few days to that, years and years ago. So the reason why this is important in the breaking down the different types of memory is that there are different parts of the brain that are more impacted by these different types. And so you have what's called episodic, from the root word episode, and this is when you're thinking about something that happened to you. So you're recollecting a conversation that you might have had, or an event that you attended a few weeks ago. That's episodic. And when you're thinking about it, it's a conscious retrieval. So you're thinking about the memory. Again, it's conscious. Procedural is, again, from the root procedure, is a bit more like, well, riding a bike. Some of us might have vivid memories of learning how to ride a bike, but if you eventually learn how and you ride a bike pretty frequently, that initial memory of that first time gets mixed in with all the other times that you've ridden the bicycle. And so that procedure becomes a little bit more ingrained, and sometimes people use the term muscle memory, and that's kind of what they're referring to. And so you may not be aware of it, but what's the famous saying? It's like riding a bike. Many years later, you can probably get back on and ride a bike. That's because the memory of that procedure is still there. It's still, and you didn't have to necessarily recollect it multiple times to be able to remember it. The episodic memory is again more important to areas of the brain like the hippocampus, as I talked about in the temporal lobe. And procedural memory is more affected in areas that are in those deeper structures like the basal ganglia. And so if there's an injury or an insult to any of those areas, like the basal ganglia, subcortical stroke, as that might be called, you might start to have trouble with some of these procedural memory type activities. I'm going to probably go a little bit more quickly through this model because the more that I look at these illustrations, they kind of get a little confusing, but bear with me, please. So there's sort of three processes we'll talk about when it comes to memory. Attention is really key in that first part. So if you think about it, a memory is only as good as how it gets in the first place. So if you're not paying attention to something and it doesn't get in, you're not going to remember it later on. And so with sensory registry, if you take this individual, they're looking at the world around them, and we think about it as a visual memory, and it has to get in. So it gets into the eyes. If their eyes are closed or they're not looking at what it is they're trying to remember, the information is not going to get in, and if it doesn't get in, it's not going to get out later. So that's attention is really important when it comes to this aspect of memory. We talked about short-term memory briefly, but these are a little bit more complex skills. Attention skills are at work here. There's this concept called rehearsal. We've all done it. If you think about it, somebody tells you a phone number that you're trying to remember and you say it to yourself a few times. That's rehearsal. And so that's actually a strategy that they'll sometimes talk about of how to remember something. You just sort of say it over and over again. You're rehearsing it to yourself. Some other ways to help work through and improve short-term memory is something called chunking. Maybe I'll stick with the phone number example. So I think I read this at one point, but the reason why a traditional phone number is recorded in 3 digits hyphen and then 4 digits is because, and it's not just like one 7-digit string, is because it's a lot easier for us to remember the 2 chunks of information, the 3-digit, the 4-digit, than it is for us to try to remember the 7 digits. And so back before we had mobile phones that we could put our address book and phone number book into, we had to memorize phone numbers. We still do to some extent, and it's a whole lot easier to remember that information instead of having to try to remember. Well, if we think about area codes now, it's 10, but if we just talk about a 7-digit phone number, it's a whole lot easier to remember 2 chunks of information than it is for us to try to remember 7 individual digits, which is what you would do if you took all those digits at one time. And so you can use this as a strategy to help remember something in the future by just sort of consolidating and grouping same information or like information together in chunks, and then trying to remember those individual chunks. I can't quite think of another example, but I figured the phone number thing was a pretty good illustration of that. This term mnemonics, again, some of us have used mnemonics. Maybe we did so a lot more in school, but a mnemonic is simply a device for us to try to remember something. So if you think of like an acronym for the planets in the solar system, or what is the order of operations in math class, please excuse my dear Aunt Sally, or PEMDAS. So that's a mnemonic to try to remember, parentheses, exponent, that kind of thing. So again, using some type of very memorable saying like that, dear Aunt Sally, to try to remember something that's a lot more complex, like the order of operations in math. So we can develop our own mnemonics. There's a lot of mnemonics that have already been, if anybody's worked in the medical field, there's tons of acronyms and different little sayings that help us try to remember different aspects of medicine and so forth. Associations, this just means that it's a whole lot easier for us to try to remember something if we associate it with something else. And so the more context you're able to provide to a piece of information, the more likely you are to remember it later on. And so forming that association is really important. I'm going to skip this emotional state, but basically it just means the emotional state that you're in when you form a memory. If you're in that same emotional state when you try to retrieve it later on, you're more likely to remember it. So the emotional state that you're in when you're trying to remember something is important. I'll just say that. And then long-term memory, the term that we like to use when you're trying to pull up a memory from something that's even just a couple days old to several years old, is retrieval. You're retrieving that memory. Certain cues might be helpful, and a cue might be one of those associations that was established when you formed the memory. Again, the emotional state is important when you're trying to retrieve the memory. If it's similar to how you form the memory, then you're more likely to remember it. And I guess I will comment on that real briefly. So if you're trying to remember something, but you're real stressed out, or you're feeling very anxious, or sort of emotionally worked up, to try to, when you first learn something, it's very, if you're trying to remember something later on, you would have to be in that same state to have a better likelihood of remembering it. So this is sort of not necessarily a warning, but just trying to explain that it's really helpful for our memories to be in a sort of calm and peaceful state, or at least not as stressed out as we would like to be when you're trying to remember, when you're trying to learn something, because if you're in that same state later on, you're more likely to remember it. Hope that made sense. Repetition, the more that you retrieve something, the more likely you're going to retrieve it later on. And then this is just those 3 illustrations all together. Okay. I want to make sure I'm not running out of time here. So what are some different ways that we can compensate for difficulties with attention? If there's distractions in the environment, get rid of them. Either remove those distractions themselves or remove yourself from that distracting environment. And if the distractions go away, your attention skills might be improved. Pretty straightforward there. Planning appropriately is really important. So if you have some kind of task that you really need to make sure you want to focus on for your attention on, make sure you have a good plan on how you're wanting to do that. Again, planning to go somewhere that's quiet, planning on having all the information and materials ready for whatever it is that you're trying to do. And so again, if you have that good plan, you have sort of a roadmap, so to speak, and then it really is helpful from an attention standpoint. Breaks are really important. So I know it's kind of funny to talk about breaks in the context of attention when, how do you affect somebody, or how do you help somebody's attention? Well, break your attention every now and then. But what this means is there's a few um, plans out there that tell people to work for 15 or 20 minutes and then take a 5-minute break. Work for 15 or 20 minutes and take a 5-minute break. And so the idea is they're kind of giving your brain a rest, you're giving your attention skills a rest, and you're not overloading your attention by having to force yourself to work for a long period of time on whatever it is. And then when it comes to, say you're working on a real big project, and it could be something like cleaning out the garage or filling out a lengthy form of some kind, sometimes it's helpful to just sort of take that big project and break it into smaller, more manageable tasks. And so you're more likely to hold your attention to those individual tasks than you are if you're just trying to take on an entire project all at one time. And so you're more likely to break your attention if you do that, and then you're more likely to say, oh, I'm not going to do this today, and then it doesn't get done. So some compensatory strategies for memory. We've already talked about these different encoding strategies, so rehearsal, repetition, the chunking, and the mnemonics. I know it sounds real sophisticated here, but write it down if it's something really important, right? And there's nothing wrong with taking notes and writing something down. But the reason why I want to stress this more so than just something as simple as you're going to be able to remember it later on if you write it down, is the actual act of writing something down, because you're actually physically writing it down and paying attention to you writing it down, you're more likely to remember it later on than if you hadn't written it down at all. This is actually more so the case for writing than it is for typing or entering something into our phone. And so if you physically write something down, you may not even need to reference it later, because you might actually remember it outright and not have to worry about looking at the notes from earlier. Again, pretty straightforward when it comes to a future appointment. We didn't talk about it, but there's actually a term for remembering something in the future. It's called prospective memory. And so when we talk about prospective memory difficulties, these are quite common. And the types of things you can do to help prospective memory is simply keep kind of a day planner or a calendar. This is something that a lot of people have done for many years and are pretty used to, and some people maybe have never kept a calendar and they're trying to start doing it now. I'm definitely a bigger fan of the paper calendars over the electronic calendars. While the electronic calendar in your phone can be helpful, because well, first of all, a paper calendar isn't going to beep at you and tell you when you have something going on. It doesn't send you a reminder. The paper calendar is a little bit more accessible. You can sometimes take it in places that you wouldn't necessarily have your phone in. And the paper calendar doesn't run out of batteries. And the paper calendar doesn't update its look and feel overnight. I know sometimes I've worked using a cell phone application, and you pull it up the next morning and it looks totally different because they updated it overnight. Hopefully your day planner isn't changing its look and feel overnight. So it's going to be the same thing every single time you go to use it. So sometimes if you can manage using both in conjunction with each other, they're really helpful. Again, with the alerts and reminders. Again, something as simple as putting a sort of a visual cue in the environment. That could just be a Post-it note. And don't get too heavy with the Post-it notes, so we don't want to overwhelm your visual field or your senses. But if you want to put a note or two in a place that you frequent at home, the bathroom mirror, the refrigerator door, even on the front door as you're walking out, that can cue you to what you need to do. And so the visual cue in the environment can be helpful in that sense. All right. So unfortunately, I'm going to have to speed through these, but again, I want to try to, if anybody has any questions about these, I can pause for a second and talk. So several steps that you can do today to help improve your cognitive health. And so there's this idea of plasticity, that the brain, it used to be thought of that the brain was sort of formed when we were younger and we developed, and as we became adults, it stopped forming, and it never regrew, never regenerated, it never healed itself. But the brain can actually heal itself, and it's through this process called plasticity. Especially we see this, and it's incredible to see, and some of you may have a personal experience with a stroke, is the rehabilitation process. And so the rehabilitation process wouldn't exist if there wasn't plasticity, because the brain is able to heal itself. Not usually always 100%, but there is some regeneration of ability. There is some regeneration of brain cells in certain parts of the brain that might be affected by that stroke. And again, that's through the process of plasticity. And so again, we can improve our cognition and possibly prevent future decline. And these tips for health go for anybody, whether or not you may have experienced a stroke or not. So not a big surprise here. This is something that our doctors have been telling us pretty much our whole lives, but physical exercise, it really is helpful for the body, but it's also very helpful for the mind and the brain. And so physical exercise, I sometimes tell folks right now, at least, is the closest thing we have sort of to a magic pill when it comes to memory problems that we might have as we get older. Not necessarily due to a stroke, but in other conditions like something like Alzheimer's and dementia. But physical exercise makes our minds healthy too. Besides just sort of the general benefit of our cardiovascular system, exercise can also benefit the nervous system, affect our brains. In the same way that physical exercise can be helpful, we talk about cognitive exercise. And this is really anything that just sort of gets your mind active and engaged, stimulated on certain task or activity. Sometimes I have folks tell me they do puzzles, they do brain games on their computer. Those are one form of cognitive stimulation or exercise, but there's a lot of other examples. So even attending today's talk and listening and engaging in the thoughtful process of this can be considered a cognitive exercise. And so good job there. But these are things you can kind of, if you're watching a talk on Zoom or back when we were going to events and things, go to the local library or the local college if they're given a free talk. That kind of thing can be cognitively stimulating. You can join a social group where there's a discussion based kind of social group, a book club, that kind of thing can be cognitively stimulating. And then you could even go one step further and learn a new skill. And so I think I'm getting a little bit ahead of myself, so sorry. Learning a new skill or hobby is actually one of the best forms of cognitive stimulation. Learning a new language can be very helpful too as well. And then I've already discussed those other ones. And so when we talk about cognitive exercise, the focused aspect of cognitive exercise in the context of a therapy is oftentimes called cognitive rehabilitation. This is oftentimes a recommendation that a doctor might make for a patient who may have recently had a stroke or is in the context of rehabbing that stroke. And if the cognitive abilities are particularly affected, then cognitive rehabilitation can certainly be helpful. Speech therapy from a speech language pathologist is one form of cognitive rehabilitation. There are aspects of cognitive rehabilitation in speech therapy. Dietary lifestyle is again very helpful, just kind of like exercise. It's again something that we're constantly being asked to keep an eye on in our day-to-day lives. Now there's a reason why I didn't say diet, because I know that word diet is sort of a negative word, but dietary lifestyle is one that I tend to want to use a little bit more frequently. And so a balanced meal that has a lot of fresh foods can be very helpful, especially when we talk about cognition in the context of aging. Back when I sort of first started talking more and more about dietary lifestyle in the context of brain health, Mediterranean diet had been around, but it hadn't been as popular. But I think more and more people have learned about the Mediterranean diet. And so this is something that is lots of fresh vegetables, fruits, legumes, seeds, nuts, whole grains. Olive oil can be a big part of the diet. So cooking with olive oil or putting it on a salad, that kind of thing. So high consumption of those items, some moderate to high consumption of fish. And so there's a lot of healthy fats in oil and fish. Moderate to low consumption of dairy and wine, and then low to no consumption of sort of non-fish meat products as well. So that's sort of the general overview of what a Mediterranean diet might look like. And that picture is making me feel a little bit hungry right now. So anyway, sleep is really important when it comes to our brain health. It's not just important to our bodies, but our brains as well too. And so there's this aspect, what's called sleep hygiene, that's really important. So maintaining a regular sleep routine, that is going to bed and waking up at the exact same time every single day. Creating a sleep cave, as I call it. So a cave would be quiet, dark, and cool. And so generally speaking, most people tend to sleep better in a bedroom environment that is dark, quiet, and cooler than general. Avoid naps during the day as much as possible. It's pretty basic, whereas if you sleep a lot during the day, you're gonna have a harder time sleeping at night. Really do nothing else besides sleep in your bed. Don't reading is, I guess, okay, but don't watch TV, don't have your computer in your bed or do other activities in bed. Just sleep. The asterisk there is sex, but sleep is the most of the thing that you want to do in bed. Save everything else for outside of bed. And then don't stay awake in bed for more than 10 or 15 minutes. And so if you're trying to fall asleep, you're having a hard time falling asleep, it may seem a little counterintuitive, but actually getting out of bed and going to do something kind of boring, maybe read a magazine or a textbook or something that's just not really very riveting, and you might find yourself feeling a little bit more sleepy, and then you go crawl back into bed and you actually might fall asleep that time. But if you stay awake in bed, you're actually training your body and your mind to be awake in bed, and you don't want that. You want to be asleep in bed. So if you can't find yourself falling asleep after 10 or 15 minutes, then get out of bed, go do a real low level activity, energy activity, and then go crawl back into bed. Pretty straightforward. Avoid caffeine before bedtime. Alcohol can actually make it harder for us to get good restful sleep. And then other stimulating activities like nicotine, blue light, and exercise before bed. You want to sort of start the process of getting ready for sleep a few hours before sleep itself. Stress and mood can be very impactful on cognition. Excuse me. Stress can have an impact on our heart risk factors, including blood pressure, heart rate, and quality of sleep. And so stress can also be really impactful when we talk about cognition. So I know I kind of talked a little bit about emotional state earlier when we're talking about memory and attention, but stress can be really important when it comes to our abilities to pay attention and our abilities to remember things day to day. So there's ways we can kind of reduce stress. One would be what's called deep breathing or diaphragmatic breathing, the root there being diaphragm. And this is kind of what it looks like. So if anybody's been around a baby recently, you look at them breathing, and they're breathing out of their bellies, and it's belly breathing. And so you can actually test this by putting a hand on your chest, one hand on your chest, one hand on your belly, and do some nice deep breaths. And if you see your lower hand rise as opposed to your upper hand on your chest, you're doing belly breathing. But when throughout the day, if we're doing a bunch of stuff or we're a little bit stressed out, we tend to take more shorter breaths using just our upper chest, and that's not too great. But this is the actual act of actually sitting down, doing deep breathing exercises, and it's this idea of belly breathing. The idea of progressive muscle relaxation, it's a little bit more complex, but the idea is that you are tensing and relaxing different parts of different muscle groups over the course of the body. And I think there's probably free apps you can download or audio files that you can find online that will walk you through the process of sort of tensing and relaxing the different parts of the body. And so there's like maybe a 10-minute routine that you can do. This is just an example of tensing, say, your shoulders for 5 seconds and then release, tense and release. And you actually don't really realize how much you're tensing throughout the day unless you do that exercise and you realize how much how much tension there was there. This idea of mindfulness is a bit newer, but again, it's kind of being a little bit more mainstream than it used to be. I always like this illustration here. So the question is, mindful of all this stuff, this person's thinking about a bunch of stuff, their mind is full, or be more like the dog here and you're being mindful. And so this is an image of what's in front of the person. And so this idea of mindfulness is you're being in the present moment. You're sort of in what's going on in the here and now, and you're not sort of worried too much about what either has happened in the past or you're worried about what's coming up in the future. You're sort of focusing on the here and now and the mindfulness aspect of things. If you do a more focused meditation, that's sometimes called mindfulness-based meditation. And so sometimes people hear the word meditation, they think that they have to go do this. You have to go out and find a beach somewhere and sit and do the pose. No, you don't have to do that. It could be something as simple as sitting on a pillow on the ground or sitting on a chair, and you can just sort of relax and think about sort of being in the present moment. There's also audio and apps out there that you can follow along to when it comes to mindfulness-based meditation. So, all right, well, just to real quickly wrap things up. So again, there are various changes that can occur in the brain based upon neurological illness like a stroke. And these changes can have very significant and lasting impact on a person's cognition, their thinking skills, in particular, a person's attention and memory. Neuropsychologists can oftentimes be very helpful when we do have these changes in the brain due to a stroke to better understand, what changes there are, how severe they might be, where they might be coming from in the brain, and then what do you do about it? So what sort of treatment could be helpful for those cognitive changes? There's a lot of different actions that every one of us can take every single day right now. A lot of these actions are totally free, including physical exercise, watching our diets, reducing stress, and improving sleep. And they can have a very, very strong and positive impact on our brain health and cognition. And I threw this in at the very end here. If you think about whatever is good for the heart is automatically good for the brain. And so those two organs of the body are intimately connected. And so especially when we talk about blood supply in the context of a stroke, absolutely, if we're doing something that is good for our heart, then you can think of it as sort of a real quick way of thinking about it's going to be automatically good for the brain as well too. So keep that in mind if you're ever curious about a different treatment or healthful activity. So thank you so much, everyone. And do we maybe have some time for